So this isn't how we imagined spending the last couple days here in Ecuador. We are outside the IESS hospital. That's the IESS hospital in Quito. It's a government-run hospital. And what's going on? My wife's got gallstones. We've known this for a while, and it's finally become an emergency. So today we came down here to see if we could get the operation and get the gallstones removed. Now, there's a lot of differences between the U.S. healthcare system and the Ecuadorian system. If you've ever heard about the single-payer system, they've got that here. We pay $70 a month, and it covers my wife and the kids. So the downside to a single-payer system that is as cheap as this is that it tends to be a little bit underfunded. We waited for a few hours and got in to see a doctor. It was actually a doctor in training. She wasn't the best listener, and now we've got a little bit of a delay proving the problem that we already know exists. We've already done a sonogram in a private clinic, and we already know that the problem is gallstones. But here they want to prove it again. Really, they want to try to find a less expensive solution than the operation that we already know is needed. And it's a long delay. Our previous experience with this hospital when my wife was pregnant, we ended up having to take a taxi to a different hospital because they were just too busy. So the pros of this system, you can get really inexpensive healthcare. It's, like I said, $70 a month for the family, and there's no deductible. It won't bankrupt you like it will in the United States. The downside, you don't always get care as quickly as you need, and sometimes you really have to fight to get to see a doctor and to get adequate medical care. The situation in the waiting room there, the people were starting to get very angry. They were starting to complain, and really it brought home to me how different it is from the U.S., where we're resigned to waiting all day in an emergency room. In the U.S., if you go into the emergency room, unless you're bleeding out, unless you come in an ambulance, you're going to be sitting there for hours and hours and hours, and you'll be sitting there all night. Here, a 2-hour wait was unacceptable to these people. But it was a 2-hour wait for medical care that really should have been a higher standard. I'm going to make some follow-ups on this. We'll shoot a little more video here when we know more about how this is going to turn out. We're waiting for lab results right now. So stay tuned. Thank you. So pretty much same result as last time. We're taking a taxi out of there, having achieved nothing. We waited and waited and waited. We were just trying to get the lab results, and we couldn't do it. Nor can we get a telephone number or any way to get the lab results sent to a private clinic. So we lost a day, and it's a day where there's a medical emergency going on. So the conclusion is the medical system in Ecuador is pretty broken. It's simply not working. The good news is, because there is a government-run system that drives prices down, when we go to a private clinic, it's not going to break the bank either. So what will happen tomorrow is we go back to a place called Equa Americana, redo our tests. They're more current so that the doctors will respect them. And then we're going to take those tests to a private clinic or private hospital, pay out of pocket in spite of the insurance that was supposed to cover everything. But really, it's the only way to get emergency medical care taken care of in Ecuador, simply because the system is underfunded, and they only had one doctor on staff, and that just wasn't effective when you've got 5-6 people coming in every 10 minutes. You just back up more and more until people find that they're so sick they can't simply wait around for their emergency to end their life. So that's the report on the Ecuadorian medical system from Jesse from Fall Off the Mount.